Oh, this is a very exciting video for me because I'm preparing for my liposuction with Dr. Giudicelli. This has been a while in the making. I wasn't able to go in December because of a time issue, so I'm actually going in like a week. So I'm just gonna be going through what you should bring, what I bring, how I prepare, maintenance. Like today I'm gonna be getting my eyelashes done because as you can see, I got some gaps. This is so exciting for me. Like, I'm so excited. I need this lipo. Yes, I go to the gym. We're not gonna say go to the gym, go to the gym. I go to the gym. I actually have a trainer. I go 3 times a week. So we're not gonna say that. I actually go to the gym. But there is stubborn fat that you can't get rid of unless you want to lose like 50 pounds to get rid of that stubborn fat. I don't want to lose that much. I would like to stay around the same weight minus 10 pounds, and I still have a lot of fat on my back and the upper back, so I just want to get rid of it. And the fat behind my arms is gonna make a world of difference. Some areas of lipo will make you look completely different. It's just like when you get a boob reduction, all of a sudden you look super skinny and all you did is get a boob reduction. It's like the same for certain areas of lipo, so I'm excited. Welcome. Do you see that? Yeah, so today is the day I have to pack. Tomorrow I'm going to DR. My surgery is on, I think, Thursday. Tomorrow's the 3rd, 4th, 5th, yeah, Thursday. So I'm scared. Like, I haven't been to get surgery in a while, so it's like, you know, the only scary part for me is going under anesthesia. So I know my doctor got me. We're gonna do this, okay? But I'm gonna be showing you guys what I pack. I've been working my ass off. I had so much content I had to do. Like, I don't think you understand what so much content means. I had to do a whole bunch of content for the whole entire month because I'm gonna be out the game, baby. So I literally got my package, went to my sister's house, took pictures for a whole entire day. The next day I went home, and then it's the next day. So I've literally been taking content all day. It's like 4 or 5 p.m. now. I have one more outfit, period. My room is just a mess. Like, all my Fashion Nova, this is like a massage pillow actually. I don't know if I'm gonna bring this or not. Actually, yeah, I'm bringing it. What am I talking about? My jewelry, all my Fashion Nova stuff, whole bunch of sunglasses. Like, yeah, it's a mess. And then in the hallway, suitcase, my dirty clothes that I have to wash before I leave, another suitcase that I was actually doing content with, don't ask, my lights, which I actually need to turn off. I was shooting. Your girl is working. I'm working my ass off so I can rest. Like, seriously, I literally worked my ass off. There's so much shit I have to do, like TikTok. I have to do stuff for my Instagram. This is how girls be lying about how they got surgery, because they take a whole bunch of content and then post it while they're healing, okay? But I'm taking you guys with me, so I'm not lying. I'm gonna go take pictures in this outfit, and then I'm gonna come back and we're gonna go through my packing list. Now, I can wait till tomorrow. My flight is not till like 9 p.m. So really, I don't have to be there till 7. I have an eyelash appointment in the morning. I don't need my eyelashes done, but I have to get a 1-week touch-up because I'm gonna be DR'd for 2 weeks, and eyelashes is very important to me. I got my shorties, okay? I had to get my nails done short. Tomorrow's my last maintenance appointment before DR. So I just want to say something off topic before I even get started. One Size setting spray, like the star of the show. When I tell you I've had this makeup on since like 12:30, it's like 11 p.m. Bitch. Usually my makeup would have been melted off after like 3 hours with the Urban Decay. Patrick Star did his thing with that One Size setting spray, for real. But anyway, so we're gonna be getting into what I'm packing and why. I'm not gonna show everything because some things I don't need to show, like Dial soap. Dial soap is great after you have surgery because it's antibacterial and it's not gonna harm anything that was done, any wounds, anything. It's antibacterial. Whereas if you use like Dove, you would definitely probably irritate some wounds. So yeah, you're not really supposed to take a shower afterwards, but I will wash my bottom half because I can't go a day without showering. First things first, loose clothing. And when I say loose clothing, things like sundresses. I'm gonna be wearing a faja under this, okay? You're gonna see the faja underneath. That's okay, because you're not here to impress anybody. After you get surgery and you're healing, you really don't give a shit. I also usually bring like a jacket. It's really hot in DR, but whatever. I'm bringing sweats. I don't have AC in my room, so it's really not a big deal. T-shirts, long sleeve to really cover the faja. Probably wear this with sweats. Short sleeve. This is loose. These I just got from Fashion Nova. I'm actually obsessed with these. It's like my favorite thing I got from Fashion Nova right now. It's like this long linen thing. So it's like if I want to get stylish or whatever while I'm healing, yeah, I'm gonna wear this. It's like these long linen pants. They're really loose. They're very comfortable. Pajamas, loose fitting pajamas. Whenever I'm in DR and I'm recovering, I don't need a whole bunch of outfits. Like, girls will overpack if you're not gonna use like half of that. I'll bring like 3 going out outfits just in case you want to go to the mall or something, or you meet somebody at the recovery house and you want to go to the mall or something, or out to eat. And then I would bring obviously pajamas. I would bring a lot of pajamas, you know, and then some loose fitting things to go to and from your doctor's appointments. That's it. I'm gonna be in recovery for about, my surgery's on the 5th to the 12th, like a week. I'm getting Vaser and the downtime is a lot less. I've gotten regular lipo and stayed around the same amount of time, so I'll be fine. Something really important and you should never forget is pain medication. I bring Excedrin and I just got a new thing of Tylenol extra strength. This is 500 milligrams each. It's so important because after the anesthesia, you do tend to get headaches and they can last for some days. Like, you might get a headache, you might be fine after the anesthesia, and then a week later you have a headache. It's from the anesthesia, it's the after effects. I always get a headache, so yeah, it's just please bring it. And they give you pain medication, but the pain medication is so weak. I don't remember what it's called. It's like these little capsules with like these bubbles in it. I'm like, are these placebos? Because they do not work at all. Would not recommend perks for healing. People get addicted obviously, but for me, I just don't like the way they make me feel. So I would not bring a prescription like that from overseas. I just don't feel comfortable in other countries bringing anything like that because yeah, it's prescribed to you in America, but like, who knows what you'll go through. You might get somebody a hating ass person at the border. Like, I don't want to deal with it. Next, Hibiclens. This is to wash yourself the day before surgery, the night before surgery. It's an antiseptic skin cleanser. It's the safest thing to use when getting surgery. When you get surgery, your skin has to be bare. You cannot have any deodorant on, nothing. And you can wash yourself with the Hibiclens. That's it. And then when you get surgery, they put more on you. I know this because when I got my boobs done, I got them redone. I was awake. This is really scary and it's still traumatic for me. I was awake until like they kept me awake until they're ready to perform, like to operate on me. Very scary, very traumatic. They usually put me to sleep and then they like wipe me down and whatever they do afterwards, but this time I was just like stretched out like this with nothing on, freezing. It's like doctors and nurses in the room. My doctor's in there, his dad is in there because his dad is a plastic surgeon as well, and I'm just like laying there like this, and like people are like rubbing me with this Hibiclens or whatever the hell, and I'm just like freezing, shivering, and I'm just like shaking, and they're like, calm down, and I'm like, bro, can y'all put me to sleep before you did this? Seriously, my anxiety was crazy. I hope they don't do that again. And then this Arnicare gel helps with healing. Definitely recommend that. Tacosol powder, usually you put it on your wounds. It helps it heal faster. It's like this powder and you like put it on, if you're getting lipo, you know, your incisions, you just tap it on. It helps it heal faster. That's prescribed, so I'm not going to bring any. Also, they prescribe you heparin, which is a blood thinner, so to prevent you from getting blood clots. My doctor does. I don't think every doctor does that, but it's like this, you grab fat and like shoot yourself. So me, I have a prothrombin G mutation, which means I'm more prone to blood clots. General population, they have like a 0.5% chance of getting a random blood clot, which is very low. So I'm like 3 times that. So I'm like a 1.5% chance of getting a random blood clot. So it's low, but I have had blood clots before from birth control and giving birth, which cause blood clots. So something like birth control, I'm more prone to blood clots. So things that cause blood clots, I'm more likely to get one. I don't get blood clots from everything. I don't get blood clots from going on planes, but I do have preventative medicine and I take it. I'm supposed to take it twice a day, but I've been off it for like a year now. But my hematologist told me it's Eliquis, and I'm just gonna I took some tonight. I'm gonna take some tomorrow morning, and then I get my surgery on Friday. This is just to prevent me from getting any blood clots on the flight, which I'd never have before, but just in case, I would hate to fuck up everything over that. And then as soon as I'm done with my surgery, I have to take the Eliquis. My doctor told me to take it regularly twice a day for 6 weeks. So that is a for sure way to prevent me from getting any type of blood clots since I have a prothrombin G mutation. But for regular people who don't, after surgery, my doctor prescribes you, I'm going to Dr. Druselli, and he prescribes you heparin. Definitely bring pads, because if you're on your period, like, I only use a certain type of pad. We can't get it in DR. Also, you should get some really thick pads to help with your faja, because sometimes, this happened to me, the smallest part of your waist, if your faja is really tight, you could end up getting a line all the way around your waist. I had a scar for about a year and it finally went away, thank God. I wasn't sure if it was ever gonna go away. It was really ugly, and it was a scar from all across my stomach, just a straight scar around my waist from my faja. So it's kind of important to bring some really thick pads, and you just put them inside the faja around the smallest part of your waist so you don't scar. But I mean, your stage 1 faja is going to be more loose. Your stage 2 faja and stage 3, yeah, definitely. So bring pads. And I would say the most important thing for me, wipes. You're going to use so many wipes. Some people listen to the doctor and don't bathe afterwards. Like I said, I have a way of bathing, but you're not supposed to. Some people will just use wipes. I can't do that. You're gonna need it for so many things. Wipes, like, you just cannot forget baby wipes, and when you get there you'll understand. I'm gonna be saying recovery home. Recovery homes are just so much better. I don't ever want to go to DR and stay in Airbnb or have a friend take care of me. The recovery homes, they literally do everything for you. Like, if you need help wiping your butt, somebody will help you. Now, I'm self-sufficient and I'm not gonna ask somebody to wipe my ass, but I know girls who have, okay? Because they literally couldn't move, whether they had a tummy tuck, whatever. Like, they're very hands-on. You know, in the morning they wake you up, give you your medication. Like, you don't have to, oh, I forgot to take my, no, there's no forgetting to take your medication. Like, you have to take it. They come in, take your blood pressure. Like, it's just so much safer staying in a recovery house, as long as it's a good recovery house. If you're not staying in a recovery house, you're gonna need to bring a lot more, because like I said, they take care of you to the T. I'm not bringing any boards or faja, because I'm gonna get fitted out there and get a brand new faja out there. Definitely bring my laptop, because the recovery house is so boring. I hate recovering. It's so boring because you can't do anything. I can't go to the beach, I can't go on excursions. Like, I have to recover. So I have to go out and I have to get the rest of my cash, because you have to bring cash, which I hate. And when you do bring cash, don't be stupid. Keep it on you. And then after your stuff goes through TSA, after it comes off the belt, check for that cash immediately. I would seal the envelope, seal an envelope, and if you see it's been opened, get them before it's too late. Like, I checked before it went under the belt and now it's not there, you took it. Because people at these airports, I go to JFK, very shady, I'm telling you. Steal luggage, like, yeah. All my electronics I obviously carry on with me. I learned my lesson with that. There was one time where I put all my electronics in my bag and the bag got ran over. Like a 1 in a million chance. This was in Philadelphia. I'm like, where's my stuff? So I go closer and it's like a bin, and it's like my bag is ripped and everything is thrown in there, and it's like everything is shattered. My iPad, my iPhones, flat iron, my makeup. I'm like, what the fuck? I travel smarter. Now I do. That's basically everything I pack, everything you really need. And then obviously your toiletries and everything, you know how you usually pack, but just don't overpack. Like, girls will pack so much random bullshit and not use any of it. Like, they have those companies that like give you packages with everything you're gonna need. For me, I wouldn't use it. I don't need itching cream and Benadryl, and I don't need all that stuff. I really don't. But if you want to go that route, you can. You're gonna find everything in DR, so if you want to have it on you, sure. I feel like it's a waste of money. I feel like it's a waste of space, and I just don't bring all that extra stuff. Definitely gonna be bringing my tripod, because I still have one picture I have to take in a swimsuit. But the recovery house, I'm pretty sure has a pool, so yeah. I'm staying in a room by myself, but if you do get a room with somebody else, definitely get a lock on your suitcase. Make sure your suitcase has a lock on it. I don't trust people. I definitely wouldn't trust that situation. I've heard stories. So if you're sharing a room with somebody you don't know, yeah, definitely get a suitcase with a lock. Very important. Usually, like the old recovery house I used to stay in, I always stayed in my own room, but they would give you a key. My hair is gonna be super easy. I got a braid down, so I'm just flipping on wigs all day. Definitely was not wearing my natural hair out. Hell no. I'm really excited to see this healing process with the Vaser lipo. I've never had Vaser before, so I heard it's so much easier. Oh yeah, one more thing. In DR, a lot of people always ask this. There's a lot of people who speak English. A lot of bilingual people. I've taken Ubers and like, you know, they're from New York. Like, they speak English, so it's easy to get around. Not all of them speak English, but a lot of people speak English in DR. It's not a hard place to travel to. It's not like you're going to like Finland, where I'm sure like most people don't speak English. DR is a very English speaking country. A lot of them have lived in America, have relatives in America, just know how to learn it in school, whatever. So DR, obviously it's not like, oh my gosh, DR is so dangerous. America is dangerous, okay? You have to be aware everywhere you go. I'm always aware. The only places I would feel safe in is like freaking Switzerland or something. Most of these places, you just always have to stay alert, be aware. If you're taking Ubers, always, you know, follow the Uber, make sure you're going the right way. Share your location with somebody. You know, always check the license plate on the Ubers. I never get into Uber without checking the license plate. I've had issues at JFK, right here in New York. Somebody trying to traffic me, like, nah. But I wasn't stupid. I'm very street smart, so yeah. But for the most part, DR is not a bad country. Everybody's so like, oh my gosh, I'm so scared to go to DR. I've been there so many times. Like, it's literally, I've even been on the countryside. Like, DR is a good country to go to. If you're not very traveled and you want to travel outside the country, DR. It's cheap, very nice. They have tons of nice places to stay at. It's easy to get around. You'll find a lot of people who speak English. Yeah, for the most part, it's not that bad. Like, can't be any worse than the US. Get over here. I'll have to pack the rest of my stuff, just like some toiletries and stuff, and then I'm going to go to bed. That's my packing video. I will see you guys in my next video. So I actually forgot some things. I packed off of that video and I never made another one. I'm already back from surgery. You can see I'm in my faja. So some things I forgot. I'm actually going to make a whole pack, because I did not have time. I'm actually going to make a whole packing list. I'll put the Amazon link so you guys can like know what to get, where to get it, all that good stuff. So packing a robe. I actually didn't pack this time. It's something I forgot. I was so mad. You need a robe because after you get surgery and you're wearing your faja, you know, I don't feel comfortable wearing my faja in the middle of the recovery house. I did stay at the apartments. I'm gonna be doing a review on that in the second video, but I did stay at the apartments of the Royalty Suites, so there actually wasn't that many people, but still, I'm not coming out of my room in like my faja, because like you have your faja on and then you have your underwear over your faja and it just looks really weird and uncomfortable. So yeah, you do need a robe just to like come out if you want to come out real quick, or if you want to eat lunch at the lunch table, or if you want to eat in your room, that's fine too. But a robe, get a long robe. Even one you could go home in if you really want to go home in a robe and you don't feel like putting any clothes on, which you can put clothes on, but if you don't want to, if you got a tummy tuck, just put a robe on. Next, Pepto-Bismol. I did bring Pepto-Bismol. I forgot to say that. Pepto-Bismol is important because sometimes anesthesia can give you heartburn and acid reflux. Also, it can upset your stomach. A lot of people get nauseous after anesthesia for a few days. I had a friend who was throwing up every single day after a tummy tuck, which is, I couldn't imagine throwing up after a tummy tuck. That is like the worst thing, because you don't even know how to use your muscles and you like have to throw up. I just couldn't imagine. But yeah, when I was on the way to my doctor's appointment one day, the driver, because you know with the recovery houses you get a driver, they take you to and from your appointments, they pick you up from the airport, you have a driver, and he was picking me up from the apartments. The girl in the car who was already in there, she had just got done with surgery. She had surgery the day before. He just picked her up from the hospital and he was going to be taking her to the Royalty Suites Chateau, which is more of like, it's like a huge recovery house or whatever. I was staying at the apartments, which was kind of more like secluded and private. And she the whole time was like, I'm gonna throw up, I'm gonna throw up. And she had a tummy tuck, muscle repair, and I just felt so bad. And she's like, when does this get better? And I just felt so bad. But Pepto-Bismol is your friend, okay? Pepto-Bismol can help settle your stomach. You have a stomach ache sometimes after anesthesia. Everybody has different effects. I get headaches. This time I did get a stomach ache though, so Pepto-Bismol, very important. Towels, you should bring your own towels. Yeah, they provide them at the recovery house, but I would bring like a couple. Also, I brought like the face towels. I always bring my own face towels. Yeah, I brought like 2 face towels. The thick pads I was saying to bring for like your faja and whatever else you need it for, the name for them is maternity pads. I didn't know what the name for them was, but yeah, it's maternity pads. Bring those. You need those when you're getting surgery. Before surgery, also you should pack foams. You can get foams in DR though. So the recovery house has recommendations for everything, whether it's overnight nurse. If you need an overnight nurse, I didn't get an overnight nurse, but if you need an overnight nurse at the hospital, where to get a faja, how to get a faja, how to get foams, like anything you need, like they will deliver it to you. Faja, I would recommend going in person. I went to Casa Columbia and they, you know, my waist is smaller, so my faja is an extra large, but the top was a large and that was still not small enough, so they took it in while I was there, which is very important. You're gonna need to take it in. okay, I got a stage 2 faja. I didn't need a stage 1 because I just got vaser lipo. If you have a tummy tuck and you get in a stage 2 quickly, you will die. Seriously, if you get a tummy tuck, you're gonna be in a stage 1 for probably like 3-4 weeks. Stage 2 is after that. You have to wait until your incisions are like kind of healed and closed. You can't just get in a stage 2, like you would literally die. Actually, the lady who did my massages, which I'll talk about my third part, she told me another girl had to have like blood transfusion. I don't remember what happened, if she had a blood transfusion. I know she didn't die, but close to it, because she didn't listen. She wanted to go to the mall before she went home, and she wanted to get like some souvenirs and stuff. My massage lady told her, wear your stage 1, don't wear your stage 2. You cannot wear your stage 2 right now. And she didn't listen. She wanted it to be cute. So of course she started bleeding like crazy. A Medibelt faja, those are like the best fajas. I got mine at Casa Columbia, and they are very, very tight and restricting. Like the material is crazy. So I couldn't imagine going to the mall and walking around in a Medibelt stage 2 faja. No, girl is crazy. So yeah, if you get a tummy tuck, a stage 1 faja, your doctor should be providing that. But while you're out there, before you leave, I would get fitted for a stage 2. If the stage 2 fits you while you're in DR and you're still in a stage 1, it's not gonna fit you once you're ready for the stage 2, if you know what I mean. Because you're not gonna be as swollen by then, but you're still gonna be swollen. So you should take it in like at least 3-4 inches, okay? If you don't want to do that, you can get a faja out here. It's gonna be the same price. It's like 150. At Casa Columbia, I paid like 145 for mine, and then it was $20 to take it in, so 165. The foams I got delivered to the house for $35, and I still have to get a backboard. I think you should bring a backboard. You don't need to get that out there. The foams, you could order them before too. But the faja, get it in DR. DR has so many places because it's literally like a surgery country. Santo Domingo is like a surgery city, we'll say. They literally have so many places for surgery, like when it comes to fajas and everything you need. In the recovery house knows where to get it delivered to you. They all deliver. Like, you're good in DR, trust me. I said the arnica already. I brought the arnica. That's for like your bruising. Like after you get your massage, you should put your arnica gel on. It helps with bruising. A long charger. I always bring a long charger because, especially if you have a tummy tuck, girl, you cannot live without a long charger. That is a necessity. When you're on the bed, when you have a tummy tuck, your pillows are just like stacked, so you're kind of like leaning like this all day, because like if you have a tummy tuck, you have to learn how to use your muscles again. It'd be pretty crazy if you had to lay down flat after you get a tummy tuck, because you're literally like a baby learning to use your stomach muscles again. So you're sitting up like that. It's harder for you to move. It'd be great if you have your phone plugged in and then it's on the bed with you. If the plug is short, you're gonna have issues. Please get a very long charger. But even with regular lipo, you should have a long charger. Like, just get a long charger, period, because you're gonna be in bed a lot and you're in pain and you don't want to keep getting up, getting down. You don't want to sit in an uncomfortable position while trying to be on your phone. You know what I'm saying? Get a long charger. Something I learned out there from the massage lady: CBD lotion. Oh my gosh, it's so painful right here on my massages. She was like, do you mind if I use some CBD lotion on you? Like, it'll really help with pain. I was like, okay, ciao. The pain went away. Now it lasts for maybe like 2 hours, but that shit works. So if you can travel with CBD lotion. That is like the smartest thing to bring. I think that is like the #1 item you should bring to DR, CBD oil. I will also link that in my storefront. I didn't think a lotion could make the pain go away better than the pain pills. I never use the pain pills out there, so I have my list from when I was out there that I got after my surgery for my prescriptions. So the painkillers are called Oxyforte. That is not what I used before, so that is something else. I don't know if those work, but I didn't take anything. And honestly, if you have that CBD lotion, you don't need to take anything. Heaven sent. A Wi-Fi box. The Wi-Fi is shit. At the hospital, the recovery houses, like, I just feel like Wi-Fi in DR is not strong. I've heard the Wi-Fi box is good, but I also don't know. So I think you could get a Wi-Fi box when you get off the plane. There's an area with people and it's right by the door to go out into the airport, like for arrivals. And I think they sell Wi-Fi boxes there. I don't bring Wi-Fi boxes. Maybe you should, because the Wi-Fi is horrible. I can use my phone still because I have AT&T, and I added the plan whenever I'm out the country. I can use unlimited data and call and text for $10 a day. So that's the plan I have. In my T-Mobile, I have 2 phones. My other one, my T-Mobile phone, I have a business plan on there because that was for my boutique. That I think was free. And then of course I get free Wi-Fi with that one on Delta. Also, I spoke about cash at the airport. Here's what I did with mine, okay? Because in DR, you have to travel. Sometimes some girls are traveling with like $9,000 depending on what they're getting. You need cash. In DR, it's You can use card for some things, but it's better to use cash because you can use cash for everything. USD, you don't need to exchange it. So with my cash, I put it in an envelope, seal the envelope before my stuff in security at the airport, before it goes in the belt. You can see on the camera, I lifted my envelope out, it's sealed, and put it back in so you can see it on the camera. And then once it went through the belt, I checked to see if that envelope was in there because they be stealing. I checked to see if the envelope was in there. It's sealed. So it's like, if anything happens, this will be quick because I showed it on the camera and now it's not there at the end. Okay, so a little street smart advice, okay? Also, if you're not staying in a recovery house and you want to bring your friend to take care of you, something in an Airbnb, I don't know everything you should bring, but I do think you should bring bed pads. If you're staying in an Airbnb, you have to get the big surgery pads for the bed so you don't bleed on there. And then if you're staying at Airbnb, I would bring some clean sheets. Obviously at a recovery house, you don't need that. So all right, so I'm gonna go over the medication list, the night before surgery list. This is from Giudicelli. This is what I got the night before, okay? So first, you cannot eat past 8 p.m. the day before your surgery, and you have to drink water until 10 p.m. You can't drink anything after 10 p.m. and then you get your surgery the next day. Also, you have to take a bath, shower, whatever, with the Chlorexin soap. It says Chlorexin soap, that is Hibiclens. That is the one I showed you guys. That's also gonna be in my Amazon storefront. He tells you to shower or bathe with it before bedtime, like the day before surgery, but leave it on in the shower for like 2 minutes before you wash it. And then the next morning, I didn't remember this because it's been a while since I had surgery. The next morning, you have to do the exact same thing. Of the morning of your surgery, you have to bathe with the Hibiclens, leave it on for 2 minutes, and then rinse it off. And then obviously no lotion, no deodorant, nothing. If you have medications like blood pressure or whatever the hell you have, you know, the doctor will talk about you with that. You would obviously have to take it the day of surgery, but you have to talk to the doctor again about that. But when you take it, you have to take it with like a drop of water. And then the medications, this is the medication list that they gave me after. So the first one is a gastric protector, which coats your stomach, omeprazole. That's so like when you're taking your medication, like your antibiotics and all the medications you have to take, they don't eat at your stomach because you have a protector that's protecting, has a coat around your stomach. Antibiotics, I took levofloxacina. That was my antibiotic. I took that once a day. Painkillers, I didn't take those. I didn't buy it at the pharmacy. They also prescribe you iron, which I took twice a day, in the morning and at nighttime. And I'm gonna be taking probably for, I don't know how many I have left. I think it's enough for like 2 weeks. I'm not sure, 2 or 3 weeks for the iron. I'm still taking that. You take that twice a day, every day after your surgery until it runs out. Obviously, because after you get surgery, you know, your body is healing, which is taking a lot. And iron is going to help keep you strong and help build your immune system. Same with the vitamin C. You have to take vitamin C. I had to take vitamin C twice a day. My vitamin C is out. I did it for 7 days. And then what's not on here is the shots, the blood thinning shots. That's to prevent blood clots after you get surgery. Heparin, I don't even know how to say it. That's what they call it over here in America. I don't know, over there they call it Mex or something. All this stuff you're gonna have prescribed when you leave. Some doctors will give it to you in the hospital. Usually at the recovery house, they'll call the pharmacy and then get the price of whatever you needed, and then you give them money and they go get it for you at the pharmacy. Also, something that you should pack, I forgot. This is not used, so don't worry, but this is very important. This is a pee cup, a urinal cup, okay? For women. You're gonna need this with your faja, okay? Unless you wanna take your faja off every single time, that means you gotta put your foams and everything back on by yourself, especially when you get home. You're gonna have to wear your faja for like 3 months. So this is very important because you're not gonna be able to take your faja off every time you need to go to the bathroom. Please get this. This will also be my storefront. Also, if you have a tummy tuck, wish I knew about this when I had a tummy tuck. This, you can pee in a bottle. And when you have a tummy tuck, obviously that comes in handy because it's very hard for you to use muscles. So you can put this attachment on and you can literally pee from the faja into the bottle. You literally just place this in the whole part of your faja and just pee. Okay, so let's go over the list. So first, a robe. Loose pajamas. I don't know how long you're staying, but honestly, you will probably wear a new set of pajamas every 3 days. Why every 3 days? Because you're gonna be wearing your faja every day in your room while you recover. You're not, unless you're coming out to eat and you're not eating in your room, either way, you would just put your pajamas on for like 2 seconds to go eat, come back in the room and take them off. You're literally the whole time, you're gonna be wearing your faja and that's it in your room. Loose clothes, again, that's just to go to like the airport, that's to go to your doctor's appointments. You'll probably go see your doctor doctor twice after surgery, unless you have some type of complication, which, you know, I don't know. Going out outfits, I would pack, depends on how long you're gonna be out there. I would pack like 4, all loose, whether it's sundresses, whether it's a loose pants and top, whether it's sweats and a t-shirt. A t-shirt! You're gonna need a t-shirt. You have to put the t-shirt under your faja. You see, I'm wearing it under my faja right now. You have to. You have to prevent scarring. I also have foams on as well. You're gonna need t-shirts, loose t-shirts, ones that will not hurt to take off. They have to be very loose. Towels, maybe bring like 2 towels. They wash your clothes at the recovery house, so, and they also wash your faja for you. Pepto-Bismol, headache medicine, more than one. Sometimes you have to alternate. Sometimes if you use Tylenol twice, it doesn't work. Sometimes you have to do Tylenol ibuprofen or Tylenol Excedrin. I use Excedrin. They do have a blood thinning agent, Excedrin, and all the other ones besides Tylenol, but it's not gonna thin your blood to the point where you're bruising all over and bleeding. So I bring Excedrin. I cannot stand having a headache, especially after anesthesia. I had a headache every single day for like 6 days. Hibiclans, which is the stuff that, the Chlorexin, the stuff that you wash with the day before surgery and the day of surgery. Maternity pads, very important for your faja. Foams, you should bring foams and your boards. Those are like a one size thing, so you can buy those before you go to DR. Your faja, you can get a faja before you leave. I would not, I would get fitted. Arnica gel for your bruising. CBD lotion for your pain. Face cloths, a very long charger, and a P-cup. So yeah, a lot of the stuff I'll link, the stuff that needs to be linked, and yeah, that's it. That is it for my packing video. This is everything you're ever going to need to know about traveling abroad for surgery, putting your mind at ease, anything you were wondering, what to pack. This is everything, okay? Now for part 2 of my surgery series. You guys will be able to see my vlog. I put a lot of information in there and what I went through and everything that happened while I was out there. And then part 3 will be Q&A. A lot of the questions that you guys asked me on Instagram, I'll be answering those. So if you watch this whole series, you're gonna know everything you've ever needed to know about traveling abroad. If you ever had any questions, if you were ever nervous about traveling abroad, if you ever have any doubts, I'm going to put your mind at ease, okay? And let you know every single thing, even the little things that people forget that you're gonna need to expect when traveling abroad for surgery. I traveled abroad for surgery a few times, so, and I'll talk about that in my Q&A. So yeah, I really hope this video helps you guys. Good luck and happy healing if you are planning on getting surgery.